Hello, everyone. Thank you for joining us. All right. So typically when we start these, we kick them off with a poll. We just want to find out kind of what's on your agenda today. What is the biggest barrier your organization faces? And I'll get through this really quickly. Good morning or good afternoon, depending on where you are. Again, I'm Angie Grover, co-founder and COO for Metopio. We'll get started in just one moment, but we really do like to take that poll, see where you're sitting, because our Parkview guests, myself, really want to make sure we tailor our remarks so that you get something meaningful out of our conversation today. So go ahead and take that poll. I'm going to go through a bit of housekeeping and we'll jump right in. We will, for today's webinar, we will have the chat on and we'll be managing that. So if you have questions or comments, I'll keep an eye on that. We can leave those in. If we don't have time or we don't get to your question, we will follow up with you directly. And the slides and recording will be distributed after today's call. So let me take a look here. And we've got some good participation, so I'm going to end the poll and share that so I can get into our introductions. But thank you for everybody who has taken that poll. And it looks like, this is no surprise to anybody. We all have limited staff time and capacity. We're dealing with a lot of siloed systems. Everybody has their favorite way to do data. And I think anybody who wants to learn about those challenges of turning data into action is going to get a lot out of this webinar. I'm really excited to welcome our partners from Parkview. So they are both graduates they're representing Indiana University. So Dr. Amelia Roebuck holds two degrees, actually, one from Indiana University and the other from the University of Texas School of Public Health, where she focused on human biology and epidemiology. She's dedicated the past 11 years to Parkview Health, working at the intersection of behavioral health medicine and public health. So kind of like in the epicenter of everything that's been happening. In that role, she designs and leads initiatives that connect data, clinical practice, and community health. Amelia oversees the community health needs assessment process for the system and advances research efforts aimed at strengthening health and well-being across the region. Most importantly for this conversation today, she is driven by a commitment to use evidence and collaboration to make a measurable difference in the communities that Parkview serves. We're also joined by Carrie Mattern. She is a graduate also of Indiana University with a degree in journalism and has been with Parkview Wabash Hospital for nearly 28 years. During that time, she's held a wide range of roles, so spanning marketing, foundation work, physician recruitment, and clinic management. Currently, she leads community health improvement and volunteer programs in Wabash and oversees service excellence initiatives at both Parkview Wabash Hospital and Parkview Huntington Hospital. Some of the key projects Carrie manages include student internships, healing arts, VeggieRx, I love that one, multiple grant initiatives, while also supporting coworker engagement. And Carrie represents the hospital on many boards and committees in the community, as I'm sure that you do. But what I love the most is Carrie has two very important self-designated titles. One is Parkview Wabash's hospital historian, and the second is Parkview's lead cheerleader. So I know you're going to learn a lot from these folks today. Again, I'm Angie Grover. I am the co-founder and chief operating officer for Metopio. And my background is largely in policy, and I joke that I'm a recovering lobbyist. So I'm always looking for ways to elevate the important work that you do with policymakers and funders to really bring attention to what it takes to create healthy and resilient communities. I've worked on a variety of issues spanning the social determinants of health with hospitals, public health, and community-based organizations, and every state except for Idaho. I will note, though, that Metopio does have some Idaho clients on the roster now, so I just have to get there. My degrees are not from Indiana University. They're from the University of Utah and Drake University. And in my personal time, I serve on several boards that focus on mental health and housing first initiatives. So that's who you're talking with today. We welcome you to our conversation. In the next slide, I just want to talk a little bit about how we are going to work together today. So for this discussion, we're going to focus on how infrastructure can fuel alignment and support collaborations to remove some of the burden of finding, cleaning, curating data, analyzing it, while also automating things that should be automated to free you and your teams up to spend more time on those plans, programs, and engagement, turning that data really into true health, better health outcomes. And for those of you who are not familiar with Metopio, on the next slide, Elizabeth, Isabella, I want to talk to you a little bit about what Metopio has to offer and who we are. So for those of you who don't know Metopio, we're a community context platform that provides data, analytics, and automation to save you time, deepen your insights, and enhance your collaboration. So much of what you do is realized in the community when you are spending time with the populations that you care about. We want to make sure that's data-driven, but that you have more time to do that. So we've proudly forged a relationship with the National Association of City and County Health Officials, and they've long been leaders in crafting the mobilizing for action through planning and partnerships, the MAP 2.0 process, which regardless of whether you're public health or healthcare, that framework really drives a complete assessment and provides a framework for health improvement plans across the industry. Our Metopio platform has won innovation awards, and we really strive to bring our partners ridiculously easy tools that help them achieve their goals. So this includes publicly available data at federal, state, and local levels, automated workflows to assist you in creating unique assessments that reflect your community and help you with those action plans for your community so that you have resources at your fingertips and you can also write grants, respond to requests, and track and share your progress. So with a deep breath, we'll go to the next slide and really dive into the infrastructure. So, we started with infrastructure because it really does matter. And so I wanted to start, Amelia and Carrie, with you. And I know as you were preparing for this conversation, you really took stock of the ways that a solid foundation can support your work. So could you touch on a few of those for us?
Yeah, absolutely. So you'll see a couple of our screenshots of our shiny new reports that we just published at the end of December. So that's for our Parkview Wabash Hospital and then the associated prioritization session slides with a lot of our data. And really here at Parkview, we've been working toward a more connected community health intelligence infrastructure through these standardized assessments, our shared regional data systems, our partnerships, and longitudinal data. And so the overall goal for us is simply not to just collect this information, but to create a system that helps us identify disparities earlier and better understand the local context across all of the counties within our service region.
Yeah, and thank you for that. I mean, it really does make a difference when everybody is using the same language and looking at the same data. And so on the next slide, Isabella, before we jump into Parkview's example of using data to drive their outcomes, I wanted to touch a little bit on rural benchmarks, which is something that Metopio offers. And it's really important. It plays into the context that they're going to share with us today. But one of the things that we've done at Metopio is, and I grew up in a farm town, so this was really important to me, is that the statewide averages, if you think of any state, there's a big city in every state, right? It's Indianapolis, it's Chicago, it's Miami, it's wherever. And so when you look at those statewide averages, they really hide the reality when you're looking at smaller communities. So what Metopio did is took the HRSA definitions for rural communities and we created a benchmark. And this is really kind of topical right now with the Rural Health Transformation Program and all the work that's trying to be done to really make sure that healthcare is delivered effectively in rural communities. So as you can see from the example, when you put, the US against, and I used Indiana for our Parkview friends, Indiana, the Indiana rural benchmark, and then maybe a county in there that's rural, you can see how it really changes the context. And while, we know rural represents 80% of the country, it's really only 20% of the population. But that can look different. What rural looks like in Indiana might be very different than what it looks like in New Mexico, which has a lot of tribal lands and other things. So, we really need to pay attention and understand. And once we do this, we get a better understanding of the drivers of outcomes. And so we can look at, not only what the disparity is in a rural community amongst our peers, so we can really see into those communities side by side, but then also look into what's driving that. So I wanted to tee that up, and I'll put the link in the chat because we have this available so you can kind of take a look and play with some of the rural benchmarks. And I think once you start looking into them, it'll be really obvious like how important this is to drive the work that you do. So on the next slide, really what this does is when all the data is available and it's consistent across the enterprise, it just makes it very easy and very clear to not only you, your partners, and your executives where those disparities are across populations like rural communities, but it also helps you understand where you have gaps so that you can make an effort to collect data to reflect the lived experience and local context in that community. And all of this really helps us use our limited resources in a more strategic way. So when we can have better data and better analysis and really hone into that, which leads us, and I'm going to turn it over to my partners to talk about how they've used this data to really impact health in their communities. Before we do that, on the next slide, Isabella, I do just want to acknowledge that while we've talked about technology, it really isn't all about technology. It's about what it empowers. And so, with that, I'd like to really turn this conversation and the bulk of the conversation over to Amelia and Carrie to share with us how Parkview is leading the way, using this infrastructure, using their data, using their expertise and leadership to affect change in the communities that Parkview serves. So I
Okay,
don't
got
know
it.
if Amelia, you're going to run
Button.
with it.
Yes. Sorry, couldn't get my
No?
mute button to undo. So we're going to be talking about just these concepts that Angie's just introduced from data to action. So using our community health intelligence to address rural cancer disparities. And then so what we observed in the data in our last cycle is that we saw a lot of cancer-related data across our region, and we noticed a really important pattern in several of our rural counties. And that was that these mortality rates were elevated, while the incidence rates for several types of cancer were often similar to or even lower than our state benchmarks. And then at the same time, we also saw that screening utilization for cancers like breast and colorectal cancer tended to be lower than the state benchmarks. So the major question for us was how do we turn into decisions that improve community health? So what did this data actually suggest for us? This raised a really important question. If its incidence is not dramatically higher, why are our outcomes worse? And what we found is that the data suggested potential gaps related to this early detection, our preventive care access, timely diagnosis, and follow-up treatment engagement. And so then when we look at incidence versus mortality, we directly compared this data, and that disparity became even clearer. So in multiple rural counties in our health system, mortality was disproportionately high relative to that incidence. And while the data alone cannot fully explain causation, it pointed us toward possible barriers in screening, diagnosis, or care access. And you can see here, this is a map of our health system for overall cancer mortality. And highlighted here is Wabash County, which we'll talk about even more throughout this presentation, where we had the highest rate of cancer mortality across our health system.
And Amelia, looking at that map, is that your service area or is that the entire county?
That's for the entire county, and this whole map shows every county where we have a standalone hospital within our health system.
Oh, awesome. Great. Thank you.
So we then layered in screening utilization metrics and found that many of the same counties with elevated mortality rates also had screening rates that were below state averages. And this helped really enforce the importance of preventive care management and engagement as part of the larger conversation. So this is just another screenshot that we have that's really specific to breast cancer mortality and mammography use. And so this is ranking, again, all of the counties that have a standalone hospital within our health system. And we see at the very top here with Wabash County that we found the highest rate of breast cancer mortality within our health system, along with the lowest rate of mammography use. So despite the availability of these healthcare resources, we saw that the screening uptake still remained much lower in some communities. So, one important takeaway from this work is that healthcare access and healthcare utilization are not always the same thing. So, even when these services exist, communities may still face barriers such as transportation challenges, workforce shortages, financial concerns, health literacy issues, competing social needs, cultural perceptions and trust. And all of these really could be contributing factors to this lack of utilization. So this is where integrated data becomes especially valuable and was especially valuable for our team in conducting the 2025 Community Health Needs Assessment. We found that no single data set told the whole story, but when we combined our mortality data, incidence data, screening metrics, demographic information, geographic patterns, and social drivers of health, we gained a much more complete understanding of our community needs. And so, tying into that, I just wanted to also highlight that this work also depended heavily on collaboration. As you saw, we're a very large health system. We have several standalone hospitals within our communities, and we reach a large number of counties within our service region. And so, this work depended on collaboration and partnerships between our healthcare systems, our public health organizations, our community stakeholders, our analytics partners in order to create this shared understanding of regional trends. And this supported more coordinated decision making across our health system for each of the communities that we work in. So, the purpose of this work for us is ultimately to inform action. And I would like to tee this up to then allow Carrie to speak more about the traction that we've gained from all of the data that we used in the 2025 Community Health Needs Assessment to now drive action in how we're addressing these disparities and these health concerns like cancer. And so ultimately, these insights can really help guide our outreach efforts, our screening awareness campaigns, our partnerships with our rural providers, resource allocation decisions, our future CHNAs and CHIPs with that overall goal of creating a more responsive and community-informed approach to cancer prevention, early detection, and treatment. And so now I'll turn it over to Carrie to talk about the Wabash County Cancer Coalition.
Thanks, Amelia. Amelia, it's an honor to talk to everybody today. I love to talk about all things Parkview Wabash, thus my self-designated cheerleader title, and our amazing community in general. And I'm gonna share a little bit about our very newly formed Community Cancer Coalition, very much still in its infancy. When we were given our community health needs assessment final results late last year, early this year, we were surprised to see cancer at the top of the list of identified health concerns. While we shouldn't have been, it was just such a stark shift from the previous 2 to 3 community health needs assessments in which obesity, mental health, and substance use had been identified. In fact, it was such a stark change that obesity had fallen out of the top 6 concerns for Wabash County. At that point, we as an admin team said, it's time to shift our focus. It's going to take a collective group. Though we are the leader in healthcare in Wabash County, we can't go this alone. So we made one of our action steps for the next 3 years to be let's form a community cancer coalition. We are a highly collaborative community here in Wabash. So I had no doubt that I would be able to convene a diverse group. And as you can see from the next slide, we did just that. It's not uncommon. Angie talked about rural communities and the beauty of rural communities, and it is not uncommon in rural communities to get groups of people to come together and make a difference. And Wabash is no different. I am a little biased. I think we're a little bit special in that it's a trait we're particularly proud of in Wabash County to coming together for a combined purpose. Together, this group of people will identify barriers, will offer resources, will help educate and track and share data as we develop, grow, and learn together from both our successes and failures. We know that's not going to be perfect. We know we're going to say, oh boy, that didn't work, and that's okay. We're going to learn from that. In our first meeting that we had, and we've just had one so far, we were fortunate to have Megan Smith and her team come, and we can go to the next slide there. We were fortunate to have Megan Smith and her team come, and she spent time talking about the different initiatives, system-wide initiatives that are really focusing on screening and prevention. And those are campaigns that have been rolled out through our marketing department and are having a big impact, a big ripple effect in all of our communities. She then took input from our group, answered their questions. She took notes, she learned some things, but it was just really great to have that support from a system level in the rural community to say, yeah, this, we're excited for you. We're here to support you. Again, nobody's out there doing this alone. Um, when we looked at the data in that group from both the community health needs assessment and also from the Metopio platform, I could hear the mutterings going on in the room. We had about 16, 17 people in the room, and I started to hear, the talk. And I was sitting up front and I turned around and I looked back and I could see like wide eyes and wow, this is really very telling. And again, while we were kind of surprised that cancer had risen to the top when you looked of a need, when you looked at all the data, wow, there really is a reason why. Um, we have one of the highest mortality rates, if not the highest mortality rate for breast cancer in Wabash County. That's scary. So while several members of this group that convened for the coalition also were part of our community health needs assessment process, all this was completely brand new information to them. So after hearing all this and the mutterings and answering all the questions, we kind of took a step back and said, what do we do now? And we shared many thoughts and comments, but the consensus, there were two very clear consensus items on that. And number one, we all agreed cancer is a real concern. And that number two, screening and early detection is at the forefront. So, what are the barriers? What can this group do to impact those outcomes? This is big. We know that. It's not a quick fix, but we have begun our roadmap for the next 3 years, at least until we do the next community health needs assessment, and likely beyond that. We did look around and realize that we probably had some people missing from the group, and we knew that would happen as discussions arose. We decided Purdue Extension, from a nutrition standpoint, should be present, and definitely transit. Transit is one of the biggest issues, one of the biggest barriers to healthcare in rural communities, and Wabash County is no different. So, adding a couple people to the large coalition. And then we thought, oh boy, what's the old saying? What's the easiest way to eat an elephant one bite at a time? We had to break this down a little bit. And so we decided, what if we organized into subgroups? What if we broke this coalition down into specific areas of interest and made it more manageable? So we threw out ideas like maybe we had an education subgroup. Maybe we had one that focused on screenings and making screenings more available. And then what is outside of all that, prevention and specifically to diet. We had a retired physician there. She was a family practice provider for years and years with us, and her passion is diet. And she's like, what is in our foods that's causing this cancer? And what can we look at with respect to that? So there was that subgroup. These may change over time, but we decided these subgroups would meet independently and we would come back together as a coalition on a quarterly basis. Again, lots can change, and even within these subgroups, you can bring more people in. Maybe we need to bring in the schools. Maybe we need to bring in county officials. Who knows? The world is our oyster. Again, we
Sure.
are so new to this. But when I was asked to talk today, I did hesitate because I thought, oh my gosh, I just don't know if I have enough to talk about. But Amelia was so encouraging, and so I was inspired. And hopefully, this little talk today has inspired some of you as well to take action, because it really is just about getting started. Thank you.
Yeah, and I appreciate that. And one of the questions that came up in the chat is something we've been hearing more and more about. So I don't know, Carrie, if this is for you or Amelia, but Beth asked, how has this work in particular improved your relationship with the quality improvement professionals in your network? So how closely did you either work with them to look at cancer screening rates, or are you engaged in them? Or is this like another group that you need to add to this because you haven't thought of it already?
I'll chime in first and then Amelia can. That is a great suggestion. We have not included our quality just yet. I do work closely with quality on food insecurity. We chose that as one of our the Joint Commission wants you to follow a social determinant of health, and that was what we chose as a hospital. So she and I work together very closely on that, but that is a great suggestion to loop quality in on this as well.
I'll add into, thank you, Carrie. I'll just add into that. I think another aspect of this that we're really excited about for our community health improvement plans and just our strategy moving forward with the community health needs assessment is being able to pull in our clinical data and loop that in to compare it to these benchmarks and this regional data.
Yeah, I think we're seeing that as a trend across the industry, and we're doing some work in Louisiana with the Louisiana Public Health Institute to look at what could some of those clinical polls from an EHR in an aggregated way, how can that inform or help you track in more real time instead of lagging indicators, more leading indicators of the impact that you might be having. So I feel like there's more and more conversations around how does this work all fit together because we're all kind of aimed at the same goal, right? Amelia, do you want to take the key takeaway slide?
Yes, I can do that. Just wrap us up here. So, just key takeaways from all of this, from everything that I was talking about with our data to translating that into real action and community impact. Like we said, we saw that screening utilization remains a critical preventive health challenge for us, despite having a lot of resources and hospital facilities dedicated to cancer. And so, collaboration was really essential for us in translating that data into meaningful action. And addressing rural cancer disparities requires this coordinated, community informed, and really multi pronged response, like Carrie discussed, with all of the subgroups we have forming within the coalition and the next steps that we have planned from there. And then I think
And
the last slide just points
yes,
to, yeah, everything that we've been using, collaborating with Metopio on. So we have our Parkview Health Community Data Hub that is free and available for everyone to use to look at data within the counties across our health system. So thank you so much for having us.
yeah, and I put that link in the chat. And also, we just want to thank everyone. I think this is so meaningful, and the reason we do these quick fire, appreciate my kind of getting ramped up here as we get started. But these quick fire use cases, I think, are so important because you can see, professionals like Carrie and Amelia are doing the work and collaborating between that assessment and what you actually do with that data. And that's what we like to help with. So if you like any more information about what Parkview is doing or how Metopia is supporting them, just reach out and let us know. We do these webinars on a monthly basis, and our goal is to bring you information that you can then take and put into your daily work. So we really appreciate you. Thank you so much for your leadership and your excitement about your communities. I think it's contagious, and I know that you guys are doing really great work, and I appreciate everybody joining us today. We look forward to seeing you on our next Metopia webinar. Thank you all so much.
Thank you.
Thank you.